Many times I have patients who come to me saying, Doctor, I have a swelling which is present in the groin region. Now, the swelling is painless, but then it appears on standing and it disappears on lying down. Whether I should worry about it? Well, of course you should worry about it, because this particular swelling could be a hernia. What exactly is an hernia? Hernia is basically protrusion of either the intestine or the fat which overlies the intestine from the abdominal cavity. So we have abdomen, which is basically like a box, and there are muscles which enclose or which cover this box. Now, with advancing age, sometimes these muscles tend to get weak. Now, the weakness can appear in the region of the umbilicus, it can appear in the region of the groins, and this is basically the site wherein the intestine or the fat starts coming out, starts protruding, and we call it as a hernia. Of course, it is not that only with advancing age the muscles tend to get weak. There are other instances or scenarios wherein hernias can develop. So if one is in a profession which involves prolonged standing, lifting heavy weights, maybe having chronic conditions like chronic cough, or if there is a patient, a person who is straining a lot during passing stools or passing urine, in all these scenarios, the intra-abdominal pressure increases, thereby pushing the intestine or the fat over the intestine out of the abdomen, what we call as the hernia. There are different types of hernia based upon the site wherein this particular hernia occurs. If it occurs around the umbilicus, it is known as the umbilical hernia. It is fairly common in females, especially who tend to be obese around the abdomen. Then there is inguinal hernia, which occurs in the groin region. This is common in males. Then there is a femoral hernia, which is fairly uncommon hernia. It is seen in females especially. And then there is an incisional hernia, which is a type of hernia occurring through the scar of a previous abdominal surgery. So why should one really treat this hernia? For the simple reason that they can get complicated. So the intestine or the fat is coming out of the abdomen, it is going in the abdomen. This is supposed to be the first stage of hernia. Sometimes it may be painful, sometimes it may not be painful. But then the second stage of hernia, what we call as the irreducible stage, in that particular stage, the hernia does not go inside and it does cause some amount of pain. And then there is a third stage, of course, wherein the hernia gets obstructed. The patient has severe pain and it becomes a surgical emergency. And at times, the intestine in the hernia sac can get gangrenous. So many a times patients ask me, Doctor, what is the treatment for hernia? Are there any medicines? Is there any belt or something that can be used to prevent the hernia from increasing? Well, medicines, if you ask me, there are none that can take care of hernia, because hernia is a structural problem. And of course, there are sometimes over-the-counter belts which are available. They are known as the hernia belts, what we refer to as the truss, TRUSS. But then, hernia belt are a contraindication to the treatment of hernia. I'll repeat, they are a contraindication, and for the simple reason that where's a belt over a hernia, the hernia is coming out, the belt is pushing it inside, and there is a lot of friction occurring at the opening from where the hernia is coming out. So a hernia which would have otherwise gone unobstructed for maybe a couple of years, due to the use of the belt and the constant friction, it tends to get obstructed faster. So please never use a hernia belt.